Our presentation is about nurses positively impacting outcomes of patients with a history of substance abuse by advocating for Narcan kit distribution. Our project includes Amanda Meeks, Elizabeth Ober, Melissa Kinchin, Christy Blair, and Catherine Krylchuk. Our question is, can nurses positively impact outcomes and reduce hospitalizations in patients with a history of overdose, substance abuse, and recurrent Narcan use by advocating for Narcan kits upon discharge and providing patient education? Our population are patients with a history of multiple opiate overdoses. The intervention is nurses advocating for supplying prescription Narcan kits upon discharge from the emergency department or inpatient beds. The comparison would be patient outcomes and hospital admissions after implementation versus before implementation. The outcome is improved patient outcomes and reduced hospital admissions. Since there can be a long period of time in between when an overdose occurs and when emergency medical team responds to the scene, it is our hope that by providing patient education and Narcan kits, this would reduce the amount of time that a person remains overdosed, because every second matters when someone is not breathing.
Significance and impact. Opioid abuse is increasing in the United States. Misuse of prescription and non-prescription opioids has been increasing since 2003. From 2002 to 2012, the rate of death from opioid analgesics and heroin has quadrupled. Opioid overdose effects are devastating and astronomically expensive. It is estimated that the cost of this epidemic could be more than $9.6 billion. Narcan costs are increasing, and it's making it more difficult for people to access. Because of the increase of opioid overdoses and the greater need of Narcan, it has been noted that there has been an increase of the cost of naloxone. The pharmaceutical company Hospira has increased the price of injectable naloxone from $62 to now $142. And the pharmaceutical company Kaleo Pharma has increased their auto-injector form from $690 to $4,500 in 2016. Right now there is not an ideal solution, so we must turn to a realistic one. Background. As nurses, we know the devastating impact of overdose on a patient's body. Opiate overdoses can cause permanent damage to the body, causing comorbidities and increasing widespread health concerns. Overdose causes bradycardia and a decrease in respirations, resulting in tissues not receiving adequate oxygen. This lack of oxygen can result in tissue death and irreversible damage like massive organ failure and even brain damage. As nurses, we have a genuine desire to help people. Oftentimes, we have the perception that helping people with substance abuse in any way other than having them completely abstain from use and join a recovery program is enabling their behavior. Our research found that this perception was wrong. Patients who were given Narcan kits did not increase their opioid use. In a 2017 study, which used surveys to examine heroin users' substance use before and after receiving Narcan and education, they found that there was no compensatory increase in drug use because of the availability of Narcan.
Background continued. Use of Narcan to treat opioid overdose without further medical treatment shows no mortality. A study done in 2003 by Vilk Sloan et al. Examined hospital records over a 5-year period of all the hospitals in an urban county to review out-of-hospital patients who received Narcan and refused further treatment, 998 cases, as well as opioid overdose deaths, 601 cases, and they used these and compared their data. They found that of these cases, not one patient died within 12 hours of receiving Narcan and refusing further treatment.
A meta-analysis study in 2013 found for every 20% of heroin users that the program reached, naloxone distribution prevented 6.5% of their overdose deaths. The study showed that for every 164 naloxone kits distributed, 1 death was prevented. Because of the life-saving measures, this allowed for people to live longer and increase the recovery rate from heroin use by 1.7%. Unfortunately, also because of the survival of high-risk heroin users, there was also a 1.3% increase in the absolute number of overdoses. There are several analyses in the study about cost effectiveness, specifically in scenarios where naloxone administration reduced reliance on emergency medical services. There was a great cost saving compared to scenarios where there was no naloxone distributed and administered. Background considerations. People with a history of opioid abuse are highly motivated to learn about Narcan use, and this education can reduce mortality in cases of overdose. In a 2017 study of 103 self-identified opioid users, it was found that take-home naloxone programs reduce mortality by training bystanders to respond to opioid overdoses. Clinical observation by healthcare team at the Inner City Youth Program indicated that young adults appeared enthusiastic to participate in the program and developed improved relationships with staff after the training. Impact to nursing practice. Currently, there is no protocol for distributing Narcan kits. Nurses have made powerful changes through nurse-driven protocols in the past, whether by initiating the removal of urinary catheters when no longer indicated, or removing central lines to reduce infection when no longer indicated, or many more. Nurse-driven protocols have made a huge impact on patient safety and improving outcomes. Our suggestion is an implementation of a new nurse-driven protocol. We want to make a nurse-driven protocol so that we, nurses, are able to put in orders for patients who meet one of 3 criteria for a kit, then provide them education and a kit upon discharge. The median length of stay at the ICU of an overdose patient is 3 days. 10% of these patients die, and another 4% are discharged to a nursing home requiring extensive care related to the effects of hypoxic brain injury, multiple organ failure, and respiratory distress caused by untreated overdose. By improving outcomes and hospital admissions for patients with opioid overdose, it allows for nurses to be available to care for other patient populations. Implementation. In a survey of 140 overdose programs and organizations, 283 Narcan kits were distributed, and 26,463 opioid overdoses were reversed. The study concluded that naloxone kits given to lay persons with appropriate opioid overdose training can help reduce mortality associated with overdose. This study emphasizes who should receive a naloxone kit or consider having one at hand. This includes anyone that has a prescription for opioids, anyone with a history of opioid or heroin abuse, family or friends of someone prescribed opioids, anyone who has access to opioids or uses heroin, programs and residential facilities that work with high-risk populations, and overall anyone who asks for it. In an effort to distribute more kits to those described in need, our group wanted to create an advanced nursing protocol called Opioid Overdose Narcan Kit. AMPs are a crucial component to ED nursing. These protocols have been approved by department physician attendings for nurses to use prior to patients being seen by a physician. These protocols let nurses start labs, urines, EKGs, respiratory treatments, and simple radiology orders, which help decrease the total length of stay. The opioid overdose Narcan kit protocol would ensure patients who arrive with a chief complaint of opioid overdose have a positive opioid urine drug screen or admit to abusing opioid drugs, either prescribed or illegal, will leave the ED or hospital after admission with a Narcan kit and receive personalized education from nursing staff. Nurses would initiate this protocol after one of 3 criteria have been met. This would flag or create a special nursing order to remind the nurse to obtain the Narcan kit prior to discharge. Similar orders have already been used. For example, pneumonia and flu vaccine administration prior to discharge. These protocols that are already in place provide a framework for the new opioid overdose Narcan kit protocol. Currently, these kits are available for those who ask for them, at UK specifically. They are also available for purchase at local Kroger and Walgreens. Although, as discussed earlier, with continuing increased costs of Narcan, these kits are too expensive for most people to be able to afford. The strongest risk factor for a fatal overdose is a previous non-fatal overdose. While non-fatal overdoses may never come to medical attention, those resuscitated overdoses that involve medical personnel offer an opportunity to engage and do post-overdose outreach to high-risk individuals and their social networks. Nurses are patient advocates, and creating an ANP that allows nurses to order this kit prior to discharge empowers the nurse and will help patients. We believe that hospitals should pay for the kits to ensure patients receive them. While this is expensive up front, cost of reducing amounts of overdose and potential complications associated with it will provide much savings. Personalized education will come prior to patient discharge from either the ED or hospital. Sometimes people don't know if they're witnessing an overdose or believe agonal breathing is breathing. Signs and symptoms of an overdose need to be explained clearly. The person is unresponsive even when giving them painful stimuli. The person has slow, shallow, or complete cessation of breathing. The person has pinpoint pupils, pale or blue lips and fingertips. Slow, erratic, or the patient is pulseless. The nurse would demonstrate where to check for a pulse. For a layperson, the carotid pulse would be the easiest to assess. Now that the patient or family understands the signs and symptoms, they need to know how to put together the Narcan syringe kit. Open the kit, remove the yellow caps from syringe. twist on the white one. Remove the red or purple cap off the end of the naloxone ampule. Gently twist the ampule of naloxone into the syringe. Place the white cone fully in the person's nare and aim slightly upwards. Spray half of the naloxone ampule into each nostril with a quick, strong push on the end of the ampule. If no response in 2 to 3 minutes, administer second dose provided in the kit. Let the patient or family member teach back to ensure they understand these steps. It's one thing to know how to do this in a calm environment and another to do it under stress. Now on what to do when they witness their loved one overdosing. Call 911, then administer the Narcan. Just like in the demonstration, if there was no response in 2 minutes, give another dose. If the person is not breathing, please begin rescue breathing. If the person does not have a pulse, please begin CPR and stay on the phone with the emergency responder.
Barriers. Perception of cost. A hospital may be hesitant to just giving away Narcan kits for free, especially considering that, as discussed previously, Narcan is increasing in price. The reason this is listed as merely perception is because the cost-benefit reducing negative outcomes for patients who experience overdose far exceeds the cost of distributing Narcan kits. Also, the value of saving people's lives is unquantifiable. Perception of enabling. Communities may have negative perceptions about hospitals who implement these plans. Cities that participate in needle exchange programs or that have Suboxone clinics have been highly scrutinized for enabling patients' drug habits. Again, this is listed as a perception because, as our research previously discussed, patients who are given Narcan kits do not increase their opioid consumption. Legal implications. More research will have to be done into the hospital, nurses, or physicians' legal implications in distributing Narcan kits. Could there be a liability issue if Narcan is used incorrectly and there is an adverse effect? Next is physician willingness to participate. While nurses can implement their protocol triggering for a Narcan prescription, ultimately a physician must sign off on this. If the physician refuses because of personal beliefs, then the nurse can't distribute the kit. In 2006, a voluntary anonymous national survey of 588 physicians found that 25% of physicians were not aware of naloxone prescription as being an intervention to reduce overdose. The study also found that more than half of physicians would not consider prescribing Narcan, and they had negative attitudes towards intravenous drug users. Pessimism in treating drug abuse and fear of repercussions socially were associated with them not considering giving out a Narcan prescription. Through our research, we have discovered the positive impact that distributing Narcan kits can have. We believe that nurses should be empowered to initiate their distribution and patient education through a nurse-driven protocol. We believe that this intervention can save lives, reduce medical costs, and help enable recovery in patients who struggle with opioid abuse.